have ways to account for this because, ideologies don't have to make internal sense. There is racial inequality that can be observed, so there are explanations for why this exists. And one of the explanations that gets offered is that it's culture, that there are cultural differences between and among racial and ethnic groups, and that those are the sources of inequality. People who do empirical research on inequality would point out there's all kinds of structural and opportunity differences that lead to inequality. And in fact, you can even look at research that, and I'm sure you all know these things, but there's agreement across our society, every class and race group, that you should go to school and you should work hard so you can get ahead. There's unanimity on that issue. So the basic core beliefs that people have are all the same. It's just that people have different opportunities to achieve. And part of colorblind ideology is also to avoid and to completely ignore, it's not even within the thought process, thinking about whites and whiteness and what whites have to do with inequality. Okay, I need to keep going to stay on track with time. So with all of these things in mind, I came to the cultural competence literature to see what I would find. And there are lots of parts in this paper, the different parts of the argument I make. The first is that, not surprisingly, it's called cultural competence. They think about race as culture, and not in terms of structure. There's a lot of othering that goes on. For example, one article said, it's not uncommon that an African American today has tried a home remedy before seeking medical treatment. Well, that is just a ridiculous thing to say, because of course all of us, almost always, we try to do something. You don't go, oh, I have a sore throat, I better rush to the doctor. You think, I'll have some extra vitamin C and go to bed early tonight, or you'll do something. But so there's a lot of times there's this distancing and othering that goes on. And most interesting in terms of culture is there's talk about how that medical students or people participating in cultural competence training should get exposure to other cultures. One article actually said exposure to, quote, local native communities in order to improve the care that they provide to patients. And that actually, I think in that article, that was as an alternative if you couldn't actually go to another country. Because this is what it's all about, that if people can have these experiences, these cultural experiences, that would make them better doctors. The other thing that's really was the most probably fascinating part of this to me was the use of race-avoidant language. In the same way that colorblind ideology says we shouldn't talk about race, these articles whose whole goal is to reduce racial inequality in healthcare tended to avoid naming race and talking about race. And frankly, you can see this everywhere. There are other cultural competence initiatives in other areas where I've seen the same thing. I'll be saying, what is your goal? It's like a little game for me. Are you going to say it? Are you going to say race? Or are you really not meaning it? Or are you just unwilling to say it? But for example, there was one study that had a sample of white and black patients, but their goal stated in the paper was, we were interested in identifying a range of potential cultural differences among groups instead of racial differences. One article said, and this hardly makes sense, but it says, the unconscious use of skin color to stereotype patients, which is something I described as research, is one of the most common ways in which cultural differences and ignorance of them pose a risk to effective cross-cultural communication. It just doesn't even make sense, but obviously what they're worried about is that racial stereotyping is going on in interactions and that we need to avoid that, but they don't come out and say it. The other thing that is interesting in this literature is that it's very power evasive. That's a term that comes from some of the early work on whiteness, and that whites don't want to talk about the power that comes from whiteness in their interpersonal interactions. And we see this in the literature as well. In an equal world, a really great suggestion that comes out of the response to criticism within the cultural competence research is that doctors should negotiate a treatment plan with their patients. So the doctor should say, I think what you should do is this, what do you think? And then you say, I don't know, I don't think I can take an antibiotic I have to take 4 times a day because of my work. And then they say, oh, well, I can prescribe this other one that's once a day. Except for that overlooks the fact that there's a huge power gap between doctors and patients. And if you all, with your advanced degrees, reflect and your good insurance on negotiating with doctors, even with as much power, as social power as we have, that is not an easy task. And so if we think about what this means, it's more complicated than they frame in the cultural competence literature. Another thing that happens is something that's really common in whites thinking about race, in a sort of popular discourse about race, is completely conflating and combining race and class. I read one article that had a sample that was entirely middle-class whites and poor blacks, which methodologically, it shouldn't have even been published. I mean, what is that? But it reflects the conflating of these two things and making them equivalent. The other way that it gets confused is in explanations of saying that something, making generalizations about racial behavior that would be generalizations about class behavior. I mean, obviously people who have inflexible jobs and rely on public transportation are more likely to be late for appointments. But that's not a racial characteristic, that's a class characteristic because of the obstacles that you face depending on your class location. People with jobs that are flexible, access to a good functioning private vehicle, they're much less likely to be late for appointments, and that doesn't have anything to do with race or ethnicity. But you see these things being combined together in the work. Actually, I have an example that I just have to share because of how horrifying it is that fits into something I don't have on the slide. One of the things that's part of whites' racial ideology right now, too, is to believe that racism is in the long past. And in fact, super long past, not Civil Rights Act, all the way back to slavery. Slavery was a long time ago. We're so far past that. And there's an article that says, and now I'll read a quote from this article, it was talking about literacy differences by race, again, conflating race and class completely. And it says, the prohibition against educating African American slaves has seriously impacted the long-term literacy of certain components of the African American population. From a sociologist's point of view, I would put this on an intro exam and say, tell why this is a lot of nonsense. I mean, racial segregation, economic inequality, funding of our public schools. We could go on and on about why we might see literacy differences in current populations, and it would be pretty hard to say that it is about slavery. I mean, it's just incredible to me what some of these articles say. Okay, and the last one is something I already mentioned, so I'm just going to move past it, but it's the Imagine White Doctor. Everything is the Imagine White Doctor. People within the literature have actually looked at this, but that white perspective being the primary central perspective is what you see in this literature, too. So, there's a lot of things that this approach makes you blind to. A colorblind approach doesn't really blind you to race, but it blinds you to a lot of other things. Some of them I've mentioned. One is culture as domination, and I sort of fit into the same area, white culture. I don't want to advocate that what cultural competence literature should do is keep the focus on culture and bring in white culture. But if you can't let culture go, at least talk about the ways that privileged culture and there can be dominating culture. And to call it just white culture is actually to assume all whites are privileged, which of course isn't true. But a culture, the ways that culture can be used to dominate. And we can think about how segregation of our neighborhoods and our schools, for example, lead to whites having few meaningful interracial interactions for most whites, and that makes doctors potentially less comfortable with white patients. And that segregation is all about white behavior within our broader society. You could talk about stereotypes and how they affect providers. And you could recognize white culture's characteristics instead of faulting non-white patients' cultures, which you do see sometimes. There's an article, for example, that talked about black patients' that used the word poor assertiveness skills, rather than talking about differences across groups and the extent to which people feel like they should make demands of doctors. And I have a whole other paper where doctors talk all about white patients demanding this, which was great. It was a great qualitative interviewing moment. We certainly didn't think they were going to say that. It was one of their most popular explanations for why white patients get more is because white patients say they want it, and then they get it, apparently. Anyway, it's a whole other talk about the meaning of them saying that and so forth. But in any case,